towards the dissertation. It's a way towards the dissertation. How do we start with the presentation? A dissertation. My alma mater, GDC Nagpur, our department. And our logo is Supreme Excellence is Simplicity. The very essential requisites of an orthodontist, which you need to develop, inculcate during this budding stage of your orthodontic post-graduation, are these 4 Ds. You need to be disciplined. Discipline doesn't mean only in your way of life, but discipline in each and every day of your post-graduation. You need to be disciplined. Right from taking a case history of a patient or giving any treatment to the patient, a treatment sequence has to be followed. So you need to be disciplined over there. You need to maintain your appointment diary. You need to give that sufficient time when called to that particular patient. Any excuses? No, because patient we are, because the patient is there. The whole life becomes peaceful when you are disciplined. You need to be dedicated. You have to dedicate yourself in these years of 3 years, solely dedicate to the subject which you wanted to master it. So you need to dedicate. You should have a strong determination. Whatever be the hard work required, one has to firmly undergo, because that is for my benefit. It is everywhere you need to have that firmness, that determination. Things planned, I have to do it. And that is all possible when you have that devotion, that love for that subject, the love for the work which you are carrying out. Because when you love your subject, stresses do not develop. Because hard work never kills a man. A person dies of mental problem. A person becomes weak because of stresses. And stresses won't develop when you love your work. So develop these 4 Ds, and I think everyone will be a successful orthodontist. So coming to the dissertation, a way to dissertation. So what's the dictionary meaning of dissertation? It's a document submitted in support for your academic degree, presenting the author's research and finding. So it is for your degree. This work is presented, the research work is presented. And this dissertation word and the thesis work often are used interchange, but no, dissertation is for the master's degree, where it is a partial fulfillment for the degree, whereas a thesis is the whole of the work which we do in a doctorate is on a particular research project. So that becomes a thesis work. So the dissertation is submitted. You have this in your dissertation. The second page, annexure, which you have to attach is a dissertation is submitted to the university in partial fulfillment of the regulations for the award of the degree of MDS. So it has to be submitted, then only you will get an MDS degree. So to get an MDS degree, you have to pass under 3 heads: the dissertation, the theory, and the practical. Under each separate head, you have to be successful. It cannot be that I will not do my dissertation or anything I do and present it as a dissertation. No, that also goes to an examiner. So you have to do it for getting your master's degree in a very successful way. Our past president, APJ Abdul Kalam, has rightly said, the best research will be the best teaching, and the best teaching will give the best research. So this is how the timetable is. I think for all the universities, this timetable follows for submission of the dissertation. Within 6 months from the date of admission, a synopsis or a protocol of research has to be submitted. So normally when the admissions take place in May, June, the synopsis of the dissertation has to be submitted by November 30th. Then you have a study time of around 18 to 20 months. I wrote 2 years because 3 to 4 months are required in your statistics in writing your dissertation. So you can give only around 24 months, lesser than that, around 22 months for your dissertation, because dissertation has to be submitted 6 months before the exam. We in MUHS have an exam in the May, June, and by December, the dissertation has to be submitted. When the exams are earlier in the month of April, then 6 months before that, the dissertation has to be submitted. And you may be given a dissertation topic in the pedagogy to submit your dissertation work. It is an optional. So it was there earlier, but now the pedagogy topic depends on the examiner. So this is the timetable. Keep this timetable in mind so that you complete your dissertation in time. So coming to what is a research? It is a research finding, the dissertation. So what is a research? Read and search. Search again and again for new knowledge or for the unknown. So you should have that quest to search what is not known, to search what is known beyond it, to search a new knowledge to be searched, then that is what is expected to be done in a research. So by definition, it is a process of systematic collection, description, analysis, and interpretation of the data that can improve the health of the individuals or the group. So in another word, in research, we change information into knowledge through critical assessment. Now, when we ask our students to get a research topic, this is what is the scenario. Oh, what research to do? All will be very much puzzled, they have newly joined, and madam is asking to get a research topic. So you should have that vision. What type of research? A research committed to quality. A research which enhances the knowledge. A research which has a clinical implication. Ours is a clinical subject. We need to benefit our patients. It is for the benefit of the patient as a whole, the research work should be. So it should have a clinical implication. And it has to be completed as per the timetable in time. So a timely completion topic you need to search for. So from where do research ideas come? Yes, madam is told to get the research, but from where? Ideas come from reading the textbook. As soon as you join orthodontics, I think for the entrance exam also, most of the students read Prophet. But as soon as you join orthodontics, the basic books in orthodontics you should read. That book shows us what is there in the orthodontic field. The literature which is established is published in the textbooks. It is there in the textbooks. We need to go beyond that. When we will come to know the unknown, when we will know the known. So one has to read, a thorough reading of the textbook has to be done in the first few months. You should read the textbooks. Journals, then after the textbooks, I'll say the journals to be read. Because journals will tell you what are the recent subjects on which the research has been done, on which the work has been done. So that will be in the journals. You'll come to know what are the new areas where workers are working. What are they showing in that, in their findings? What are the limitations in that? So you will come to know in the journals. What is the future scope for a particular topic? You'll come to know in the journals. And those topics can be picked up. So that will be an area of research for you to extend that work further. So a search of the literature is essential before deciding whether the research is worth doing and which are the areas that need to be addressed. Ideas come from be a good observer. In the field of observation, chance favors only the prepared mind. You need to be observant. When we tell you to see the patients in the OPD in the first few months, 6 months, we post you in the outpatient department to do the clinical examination. So the students take it very lightly. At times they don't like it also. I have seen in my experience of 30 years, why madam is asking to see the patients. So in that, you should see your patients properly. Do a clinical examination. You will come to know what has deviated from the norm, what has gone wrong from the normal, that this patient needs a treatment. There you'll try to find out the etiology of that particular malocclusion. What could be the factors that has turned this normal into an abnormal? Hello? So that has turned a normal into an abnormal. You will look for habits. You will look for all etiologic factors which are there in that particular patient, and then you'll start thinking, how can I treat this particular patient? If this patient would have come earlier, what could have been the treatment plan? What if this patient is not treated right now? What will be the outcome of it? How will the patient look after the age, after 5 years of this? So all this, you have to give a thorough thinking over there. You have to think thoroughly on all these aspects when you are doing the clinical examination of your OPD patients. When you are posted in camps, maybe a school camp, maybe in organization, maybe in a rural areas, the things are different. In an urban area, the malocclusions are different, the etiologies are different. Their prioritized problem list is different. Okay, but in a rural area, everything is different. So you have to treat the patient as per their chief complaint, and many things open to you why things differ in the two settings. What could be the dietary habit, and many more things then open up to find out why this malocclusion and how to treat those malocclusions. So be a good observer. So that will open up new ideas for research. Yes, be a team player. Now, all PG activities have, all departments have PG activities, and they have seminars. What happens is when we give a seminar, the student who is presenting a seminar, only that student prepares for the seminars, whereas others are just passive listeners. No. When a seminar is allotted, it is that particular topic, all of the students get, prepared in that. Voice. Again to start out.
Thank you, ma'am. You can please continue, ma'am. Thank you.
I was not audible till here.
You were audible, ma'am, but there was some issue with the host. It's okay. It's done, ma'am. Thank you, ma'am.
Okay. So be a team player. So when the seminars are allotted, not only a student to whom a seminar is allotted should be prepared, other students should also be well prepared, so that at the end of the seminar, a discussion can take place. At the end of the seminar, you can participate in that discussion. All doubts you can clear up over there, so that that topic is thorough with all of the students. So you should participate in the seminars, be a team player, be a part of that seminar. It is not just a passive listener. Journal clubs are there. Beautifully, it has been told by the earlier speakers how a journal club to be presented. In journal club, many things you come to know. What are the topics on which a newer research is taking place, the way the methodology is, the way the scientific writing is, what could have been over there that the limitations could have been overcome. So can I work on those limitations so that there is an answer to those limitations? Try to question yourself. So it is not just attending any PG activity, a seminar, a journal club, or a case discussion, but you should participate in the discussions. Then we have an interdepartmental meeting or an interdepartmental PG activity. It is rather every department presents every month their work done, the cases done, the neighbor something done by their department. So you should be there, a good observer, a good active over there rather, not a passive listener. You should try to find out how I play a role, or what would be my contribution in this particular patient, in this particular case. Because after all, it is not specialty treating, it is a patient treating. So can I do in a perio-ortho relationship, can I do something for this periodontally compromised patient or a patient with a prosthodontics? Can I use that implant of a prosto for my tooth movement, for orthodontic tooth movement? So try to think this way, where could be my contribution in this other department patients? So attend the interdepartmental meeting. You should all have the interdepartmental meeting, and every student should take it very seriously and attend it. Then PG conventions are there. Yes, PG conventions are meant for postgraduates. They should attend all the lectures because every lecture teaches you something. Even at this age of ours, we attend the PG conventions. Why? Because many things we learn from each speaker. Even if you listen to the same speaker in the different conventions or the conferences, something new adds to it. So be positive those newer things from that particular speaker. So attend the PG conventions. Nowadays, I find in the DCI syllabus, 2 PG conventions is written. And the student says, Madam, we attended the first and the second year PG convention, no more the third. So don't be so calculative. The PG conventions are for the PGs. They open up newer ideas. They speak, or you come to know a newer research on that particular topic. What could be the newer treatment modalities, and everything you come to know over there. So as far as possible, we do understand the registration charges of the PG conventions and all that, but try to attend it. PG conventions are for the PGs, and in those, try to be an active participant. So ideas come from discussion with colleagues, mentors in same or different disciplines. So this is the PG activity which we had last in the month of January, our turn was, and that was the topic. And that is the way in our college we organize the link activity. We call it a link, lively interaction, nurturing knowledge. Then be techno-friendly. There's no doubt about it. You all are techno-friendly. So there are many database search literature available, the electronic literature available. Medline is there. This has been already told by Srividhi Devi Madam, very beautifully covered by her. Then you have a PubMed where abstracts are there, and PubMed Central where around 6.4 million full text articles are there. So it is an US medical library access, and you have it at your click. So you people get it, everything. So there is no problem getting ideas or topics for research. Now, what drives you in health research? Ours is a field, ours is a branch, a specialty of dentistry for the benefit of the human being, a service to humanity we are giving through our services. So what drives you in health research? Yes, research comes through necessity, need, a need for action, to do something for our patients. That brings you to a research drive. To address a problem, yes, we see many of the problems in our OPDs, in our patients. The question should be, how can I address it? How can I treat it? Now we had a patients, at times we get a wave of particular malocclusion in the OPD. For example, it happened that in my OPD, I got all growing patients with an open bite almost 5-6 years back. And the question was, why open bite? If these growing individuals, if this open bite continues, won't it develop into a long face syndrome? Won't it make that face so long that later on a surgery will be required? The whole of the growth will then grow in a vertical direction. And then this growing patients will need a surgery at the end at no cost. Camouflage will correct that appearance. So I had patients flooded with open bite during that time. And then I said, okay, we need to correct this. We need to control that mandible, which is growing vertically. So we then came up with a spring-loaded bite block and the magnetic bite block, so as to arrest the vertical growth and redirect the growth in a horizontal direction, so that the growth of the maxilla and mandible is harmonized and the average growth takes place. so that later on no surgery is required in this particular patient. And we did get the results. The thing is, we address the problem at a right time. So we have to see to it, why is this problem and how can we address it, minimize the malocclusion and the treatment later on. Surgical treatment are not acceptable. Even we will think 100 times when we want to give it to our own kids. So it is like addressing a problem. Develop newer interventions. You feel like in this particular case, something new has to be developed. We often see a removable appliance being given to our patients. We give retainers to our patient. And then the patient doesn't wear it. And the patient then says, oh, the relapse has taken place. And they charge us. They then say, no, the treatment was not proper. No, the retainer was not worn properly. So then in such a case, we need to see for the compliance of the patient, how many hours the patient is wearing an appliance. And this way, it made us, innovate a sensor for measuring the time the appliance the patient is wearing. So time measuring appliance made it a sensor we tested with the work collaboration with VNIT. And then now, when we place it in our removable appliances, we are coming to know how much time the patient is wearing. So wear time measuring device we made, it was an intervention. It was for what? To solve the problem. After all, the orthodontist are sued for patient not wearing the retainer, a removable retainer, in spite of doing so much efforts. So we have to come up with just something newer things. And at the same time, it should be cost effective. Ours is a developing country. Just costly, appliances, equipments, we just can't afford it. So we have to see to it how cost effective. Now, we wanted to get the sensors from USA, very, very costly affair, and they were not also sending it, importing it. So we were not getting it. So in that case, and it was a very costly affair. So that made us work with the VNIT. Why our engineers are not good enough to do it? I questioned myself. And a young student of the MTech, he came up with the answer and he devised a sensor. So it has to be a cost effective, hardly charging 500. So I think this way, the need for action drives you towards the research. And very important, the research cannot be without curiosity. You have to be curious. Discovery is the prize in the research game. Have that curiosity. Why this? Why this? Why things are happening this way? What can I do to overcome it? And that will drive you towards a good research. All researches are good, no doubt. There's nothing like a bad research, but a research which will help the society, a research which will contribute towards our patient services. That should be the research. Then profit. Many of the industries come up with the newer appliances. They want us to work on it so that they can then present the evidences. So at times they fund us, or they themselves give us all those appliances and they ask us to work on it. So that could be a profit sometimes. You may get an opportunity working with collaboration with an international research, a pharma company. So in such a case, for example, there are few of the malocclusions or few of the problems in orthodontics where you do not get samples. We did a genetics study on, we did it and we were doing it on twins. We didn't get a larger sample. Study never got accepted. The thing is, such a beautiful study which we studied on twins, a monozygotic twins and a dizygotic twins, but no, samples we couldn't get it. So in such cases, we need to have a multi-centric project where the similar study is being carried out in different areas, so that will give a larger sample and you'll get an answer to your research question. And you should take an opportunity of working with the engineering department. Ours is a field of bioengineering. The materials which we use, everything comes under material sciences and engineering. So every aspect of it, a research can be done. And we need to have a good collaboration with the engineering department. In Nagpur, we have a VNIT department. Even they are doing a dissertation or a research work on our appliances. For example, in Savingli only, Srivastava madam guided a PhD scholar of VNIT on a lingual appliance. So both are benefited. The thing is, we need to tell them our problems. We want this to study, and they will come out of it. You need to have several meetings. You need to have a perseverance. You need to have a curiosity, and definitely you will come out with a very good research work. So all this provide advantages to the investigator. Remember, health research is not a luxury, but an essential need that no nation can afford to ignore. It is a need of the hour, it is a need of the nation, and health research in the field is required. So the question in your mind now must be, what are the areas of research in orthodontics? Madam, please tell us the topics now. So that could be the question in your mind. And yes, I have listed a few. One, growth and development. Since a century, I'll say, many studies on growth and development have taken place. Normal growth, the abnormal growth. During animal studies were there earlier. Now studies on humans are taking place. And in growth and development, there are many areas. Abnormal growth, the syndromic, the craniofacial anomalies, the cleft lip and palate. In Savangli only, a beautiful study where they have studied the swallowing pattern in cleft lip and palate. See, what a beautiful question. What could be the swallowing pattern in a cleft lip and palate? Yeah, we need an answer to this. So that adds to the literature. We know the normal, we know in a normal tongue thruster, but what in a cleft lip and palate? So these are the areas where studies are required. Then genetics is an area where more studies are required. I know the cost factor involved is very high. We also try to do the genetic studies, but when it is not funded, then in such cases, it is difficult to carry on, because you need to have a larger sample also, an appropriate sample also, and then studies are required in the field of genetics and molecular biology. We need to go more into the depth of it, where other specialties in the field of medicine have gone much beyond it. Then imaging technique, the essential diagnostic aid, it has become. Earlier the cephalograms were there. We used to do a 2D of a 3D face, but now CBCT has come up, and there are many studies coming on CBCT, MRI to study the soft tissue, to study the articular disc, where we don't know how the articular disc moves. Change in the articular disc position, which we studied with a MRI, with a bionator, and with a twin block. And what was the pre-treatment position and what after the treatment? We need to know that, because that you cannot study with your cephalogram or with your CBCT. You need to see how the disc changes its position. Does there a harmony between the condyle, the disc, and the glenoid fossa is achieved? Because that's the objective at the end of the functional appliance therapy. So these are the areas. EMG studies were done quite earlier. Still also it is being done. In our open wide subject, we studied the EMG. Does the muscle tone improve pre and post giving the appliances? Then USG is now coming up, where studies, few studies are there, much are needed. CT has a higher radiation dosage, but to do a FEM, you have to take a CT of a skull model. So you have these areas of research. Then diagnosis and treatment planning, a very vast topic. So much of it should be there in diagnosis. There are so many areas of research in diagnosis. Now we are studying more of a soft tissue. So tissue is considered to be fourth dimension. So many, the diagnostic aspects of the soft tissue are to be studied. So that an area of research. Then classifications are there. Different classifications have come up. Every classification has a limitation. There was a limitation with a beta angle, so I came up with a W angle. So that way you overcome each limitation and you come up with a new parameter. So that can be done. Even in treatment planning, every malocclusion can be treated in a different way. That's the fun in orthodontics. The fun in orthodontics is treating the same malocclusion in a different way. And you should enjoy doing it so that you learn more and more. And then you can try for newer and newer appliances. So appliances are a tool of treating a malocclusion. And there are so many appliances which were there, which are there, and which further needs to be modified, addressing a problem in a particular patient. So you can work on all aspects of these appliances, right from the materials to the treatment mechanics. You can study on it. A decade back, there were lot of research on lingual appliances. All studies which were there on the label were on lingual, were on the self-ligating bracket. Now studies are there on aligners, because aligners have become now the need of the hour, patient's demand, and we need to have an evidence. When we do a study, many of the workers will do a systematic methodological study, then in that case, we will have an evidence. So appliances are the area. You know, magnets were there. In 1970, Derendiller had given. Then I said, for a long time, no study on magnet I could see in the journals. Where have these magnets gone? The magnets were first used to close the spaces. But later on, we did not find any magnets only. And that gave a thought, why can't we use magnets right now? Aren't they available? Aren't they biocompatible? We will not get it of that miniature size which we want to put it. And a search for it, a quest for it. And we did get a magnets which could be placed in our bite blocks so as to bring about a correction of open bite. So that search should be there. Then treatment biomechanics. Everything, ours is a mechanics. It has to be done in a very systematic way. It has to be done in a proper sequence, everything. But then we have areas over there. If we modify it, what type of results we will get it? How will we come to know when we do a research? We were used to, with an expansion, with an RME, TIMS schedule. But if we do it alternate, what is the net gain? If we do a study, then only we will come to know now what is the net gain. So studies are to be done. And that way, the alt-max came. Rapid tooth movement, accelerated orthodontics. Yes, everyone, time is precious. It is for us, so is for patient also. Why should patient ask in how much time the treatment will complete? That's a question. Patient does ask, and the patients now, everyone is career oriented. Everyone has very less time for oneself, wants to do it, but the time schedule doesn't permit. So why can't we think about a better accelerated mode of treatment, accelerated tooth movement? We knew we had a surgical methods. Yes, we know the disadvantages of the surgically assisted rapid accelerated orthodontics. But then there are drawbacks. There are drawbacks. We know it's invasive. So then now the least invasive has come, the micro-osteoperforation. So studies are there on micro-osteoperforation. One of my PhD student is doing on it. But now studies have come up. So of which, what can make it less invasive? Then devices are there for accelerating the tooth movement. We came up with an LILT for accelerating the tooth movement, the least invasive. And we did get the results. But then other devices shouldn't be tried. After doing that LILT study for accelerating the tooth movement, I wanted to answer what exactly is happening at a molecular level. What changes are taking place in the bone remodeling? So we did an MMP9 in a GCF of that LILT treated tooth. So that what is happening at that level, a molecular level, that accelerates. That question should be there. What exactly is happening over there at that molecular level? So I need to go further, one step ahead. Then there are many devices for accelerating. We did it now with an electromagnetic device. A small watch battery with a magnetic field was placed in the appliance and the patient was asked to wear it. And we did get the result. Very patient friendly, but we could get a result. 6 months required for a space closure. A space closed in 4.5 months. Won't that 1.5 month benefit to the patient? It is a benefit to the patient. So with that, we need to do further studies where en masse retraction or the complete treatment to be done. along with that device assisted. So that we'll come to know that 26 to 30 months required for the treatment, does it reduce to 24 months? So that answer we will get. So this way one has to proceed step by step on further and further research in a particular field. So there are many areas. The treatment biomechanics, ours is a subject full of biomechanics, and there are many areas like this. Early treatment, yes, early treatment. Patient comes nowadays, patient wants, when I come, I just can't say, wait, watch, let the spurt be over and then we will treat it. No, everyone is impatient. So if doing it early, what benefit it will be to the patient? So that we have to come up with a newer appliances. Should we treat a class 3 at the age of 5 years? Yes, a handicapping malocclusion. We got very beautiful results when we did it with a face mask and a reverse twin block. It worked beautifully. The whole harmony was brought about in the maxilla and the mandible, and the growth was established to a normal average growth. So can we give that intraoral appliance versus an extraoral appliance? That should be a question. When you give an extraoral appliance, you have to depend on the patient. But the intraoral appliances are more patient friendly. You can put components of the other appliances which we did, and then we got it with a reverse twin block, with the addition of lip pads. We got very beautiful results, and the patients were very comfortable. We could achieve the result, and the same appliance could be maintained as a retainer. So every malocclusion should be thought of. What could I give the treatment before in this early growing stage? Because we know any changes or treatment carried out during the growth will be a stable growth. The patient will get the results at that particular age before going into that college, young adolescent age. So that should be aimed to give the best before he goes into the society as a young adult. Material, yes, as I spoke earlier also, materials in the Angel's era, gold was from there. Many materials for the arch wires have come up with the supercable wires, the Optiflex wires. Many wires have come up, and we need to test those wires, work on it, and see for do they give the best results. When I say a wire, we know it is an active component. We give it. We want to see, does this wire fulfill the ideal properties of a wire, arch wire, biocompatibility, less of a friction, all that. So one has to study it. So in the same way, we studied the best combination which can be given. Because see, now everyone demands aesthetic brackets. But in a ceramic bracket, giving a stainless steel wire, how much aesthetics we are giving to the patient? Why shouldn't we give a colored wire? So that was the objective behind the study. So we studied a stainless steel wire in a stainless steel bracket, a ceramic bracket with a metal slot, with a colored niti, and all the combination we studied. And then we found that stainless steel with a stainless steel wire with a stainless steel bracket and a colored niti with a metal slot ceramic bracket is almost similar friction. So we had to study that with the VNIT. So profilometer, the surface roughness, the SEM study, all those are the studies which can be done on materials. Then yes, bonding, attachment is bonded, be it a label, be it a lingual, the attachments are bonded. Many materials are coming up. Bonding since long, means 30 years back when I did my study on bonding, the bond strength, So since then, there are bonding studies, and there are still more areas to study in this bonding, the adhesive, the primer, the 3-step bonding method, the 2-step bonding method, then we did a 1-step bonding method, then the surface preparation. What can be used for the surface preparation? Means in our department, right from 1985 till I say 2007, we have around 20 to 25 studies on bonding. Mine was the first study where I used, in 87, where I used, instead of 37% phosphoric acid, a 5% phosphoric acid. My question was, why shouldn't we use a 5% phosphoric acid? Does 5% phosphoric acid give a same bond strength as a 37% phosphoric acid? Does 5% phosphoric acid damage less the enamel prisms than a 37% phosphoric acid? That was my question. And yes, I got it. 5% phosphoric acid showed a least damage to the enamel. That which I studied in SEM in 1987, going around 20 kilometers on a Luna, and there that SEM machine was also new over there. The engineer also couldn't get answers to some of it. I had to come back then. So you have to. So that is the way that SEM was done. Then bond strength I studied on an Instron hardness testing machine with a 5% 37% phosphoric acid and a 37% phosphoric acid and a 5% phosphoric acid. Does it give an equal bond strength? I did it in VNIT during that time. And I got it. If 5% phosphoric acid causes the least damage to the enamel and gives almost equal bond strength of 37%. And that's the article first published of mine in 95 in AGO, where at that time, T.M. Graeber was the editor. And he beautifully commented, yes, lesser the better. That was the comment given by Dr. T.M. Graeber. So there are studies in bonding, though bonding studies were done since 3 decades, but there are still more to come up with on bonding, on every aspect of bonding, all the materials used in bonding and the curing light also, which is used in bonding. During our time, we used to do a self-cure bonding. But at times now also, I feel a self-cure is better at some where moisture control is difficult. Better a self-control, and you get a bond strength in that case. Then multidisciplinary. This is the need of the time. We are within our brackets and archwire, what I feel so, but we have to work with other specialities of dentistry. It is now to come out of this orthodontics and work with other specialities of dentistry, like the orthoperio, orthosurgery, So these are the field where you need to do more and more work, and other specialities of medicine also, I say. And that brought me to study with a sleep physician, the cases with an apnea, the mandibular repositioning device, which I got it patented. And that worked beautifully, that worked beautifully in all the patients, which was sent by my sleep physician of Nagpur. So you have to convince them, sir, the appliances will work. Just give me a sample and I'll see it. Otherwise, respiratory system is a very vital organ. You just can't play with it. It will be his patient. It will be their patient of medicine. But in that case, if our appliance, a very economical, patient-friendly appliance, which doesn't create any phobia to the patient instead of that CPAP, if that can be given and the patient has a quality life, why can't we give it? So we have to come out of our globe of orthodontics and work with other specialities, the sleep medicine, the ENT people, even an orthopedician. There are many spondylitis cases. Certain malocclusions are correlated with it. So you need to work on these type of areas, which at times patient doesn't speak to us. Patient doesn't complain to us. Patient will never complain to us about apnea because he says you are an orthodontist. What should I tell about snoring to an orthodontist? But it is during our case history, we have to ask the questions. We have to see for the breathing pattern. And that way we can come up with areas where we need to, invade. We have to go into those areas and do a research. So that's needed. So then what are the criteria for a good research topic? It should not be a repetition of a previously undertaken study. In MUHS, it is that the last 5-year studies the students should go through, and there shouldn't be any repetition of the same study. You can look for another aspect in that particular study, but no, the title should not be the same, and the aim and objectives should not be similar. Explore some new aspects. It should be feasible. You don't think something which is just not possible. A very, very newer innovation which will be time consuming, which requires a lot of fun, which requires a lot of time. No, I have to complete my theory part as well as the practical part of my post-graduation. So things which are feasible, things which can complete in the time which is allotted to me for the dissertation, those should be done. And it should produce a valid information and knowledge, that will ultimately have an impact on health of the patient. So keeping an objective, I am treating a patient. So a research which will benefit ultimately the patient, not just the malocclusion, should be thought of. It should be interesting, yes. Now, we guides tell the students to get the topic, because when they get the topic, their area of interest will come to know. Because doing it interesting, the student enjoys that work. Student doesn't develop stress. He devotes himself for that work. So therefore, the work or the topic which you are interested in, that you should try to convince your guides that this is the topic. And then the guides also, the teachers also think over it. Oh, the student is interested in the topic. I know what is established fact. Now in this area, what unknown we can find out. So that is the way the topic should be of interest to the investigator and the community. Novel means does not necessarily a totally innovative or new project, but a research that will add to the existing knowledge should be done. Then it should be ethical. Yes, this ethics topic has been very well covered yesterday by Dr. Toshniwat. I'll just revise it over there. Then relevant. Ours is a clinical subject. It should have a clinical implication. In all the studies which come to me for review, I always look for what is the clinical implication of this study. How it will affect orthodontic treatment planning, diagnosis, appliances. So that clinical implication should be there in your study, and it should be verifiable or measurable, means it should be reproducible. So with all this, you have decided a topic for research, and then you come to making a title for your synopsis or a research protocol which you want to submit. So then you should write down that title around 8 to 10 different types. In a different ways, you should write down first, and then you should find out whether that title is concise and informative. It should follow a PICO format. PICO means population or the study group. I is the intervention, C is the control, and O is the outcome or the characteristic which you have studied, you want to study in that particular research. At times, you can add a subtitle. For example, a cephalometric study, a MRI study, a CBCT study, in vitro study, an FEM study, or it could be an RCT. So that is added as a subtitle. Then you frame your research design. Now, this research design, it is difficult to take in this presentation of mine, because on every aspect, research question, one full lecture can be given on it. Hypothesis, one full lecture can be given on it. And this is very well covered in the research methodology workshop. Every first year student, before giving the basic sciences paper at the end of the first year, has to attend a 3-day research methodology workshop as per the DCI syllabus. So every year we have it in our institution along with the MUHS in the month of August and September before they start with the synopsis of their dissertation. But because of pandemic, the faculties are saying it just cannot be taken online. It needs, offline, where exercises are performed, group discussions are done. So these hurdles are coming up, but very soon the dates will come up for the research methodology workshop, which is taken by the faculties of MUHS. So I think in every university they have, because it is mandatory, the student should do a 3 days research methodology workshop. And in that workshop, on this every topic, one full lecture is there. Research question, hypothesis, then research strategy, the sample design, sample size, material, method. For every aspect of this strategy, you have questions. Science should be questioned, it shouldn't be admired. So the first aspect, research question. The very first thing in your study is why the study. A question should be asked, why the study? I have read the background, I have read the review of literature, I have read my textbooks. Now, what's new I am going to do in my study? So that is the purpose of your study, because it has to be something which adds to the existing literature. So the purpose of the study makes it aim of the study. So you should have a very clear research question. What do you want to study in this particular study of yours? Then what to study? What are the parameters? What do you want to study to fulfill this aim of your study? Which are the parameters you're going to look for? So that will be the objectives of your study. For example, you want to study the skeletal and the dental effects, compare the skeletal and the dental effects of BioNator and a twin block. So your primary objective is to assess and correlate the skeletal and the dental parameters of patients treated with twin block and BioNator. So that's your primary objective. So you should have a primary objective, and then you can have secondary objectives. So why this study will give you the answer, the aim of the study, and what to study will be the objectives. So the objective should meet the purpose of the study. It should be formulated very clearly, and it should be expressed in measurable terms. It should be quantifiable. It should be reproducible. So that is the way the objectives should be. So question well stated is a question half answered. So research question should be very clear. Then you have a hypothesis. Now the word hypothesis, there are many confusions regarding this word. It is an assumption. For example, when you are going to study the two intraoral functional appliances, BioNator and twin block, my assumption will be, or we will assume, that both the appliances have equal skeletal and dental effects. That will be the assumption, because both are intraoral, both are functional appliances, both are given in a growing stage. So the end result should also be almost the same. So this is my assumption, my hypothesis. But if at the end you get more of a skeletal effects with twin block compared to the BioNator, then your assumption or your hypothesis is nullified. It is rejected. So it becomes a null hypothesis. But if you get an equal results, then it is an alternate hypothesis. So hypothesis is not to be proved. You don't want to prove that hypothesis. You want to test that hypothesis. From your study, you will be testing it. Are they equally effective or they are not? That is what you are going to test in your study. So that is a hypothesis. Then the research designs. Yesterday it has been explained very well by Sridevi madam also. You have an observational study, you have an experimental study, then an observation, a descriptive study, an analytical study, and an experimental study or an interventional study. You have a randomized control trial, the level 1 study, which is called as, or the other could be where you do not randomize, a non-randomized control trial. When you do not randomize the samples, then there are chances of bias. So it is always better by different methods of randomization. You should randomly allocate the samples to the groups you are studying. So most reliable RCTs are most reliable, should be considered when it is ethical and practical. Non-randomized studies have biases. Then sample size. What sample size to use? At times there are many questions on sample size, but this has been made very simplified by the sample size formula, and there are softwares to calculate the sample size. So the sample size should not be very large enough. There's a waste of resources that happens, waste of time, waste of money, everything. And at the end, the same result which you will be getting with an optimum sample size also. And it should not be so small also that everything goes waste, that you do not get a definite answer to your research question. So you should have an optimum sample size which gives reliable results with minimal errors. So there are formulas for this. The next lecture is by Dr. Goyal sir, and I think in biostatistics, he will be very well covering this topic. how to calculate the sample size for a quantitative data, the formula is there. Qualitative data, the formula is there. And then after calculating the sample size, you decide your sample size. And then you try to write your research protocol, a synopsis protocol for your dissertation. But before that, ideally, though I know the time doesn't permit because the date for the synopsis submission comes very soon, but you should do a pilot study in few samples. Pilot study is nothing but a rehearsal of your study, where you can identify the defects, where you'll come to know the problems, where you'll come to know how more precise I can be with my study. Your concept, your methodology concept will be very clear. You'll come to know what are the problems which I have to face, how will I overcome this problem, and then I'll get a very precise methodology, a very systematic way of working in my study. So that will make you familiar with your setting, with your phenomena, with your study. So ideally, the pilot study should be done on few samples, not more. 2 or 4 samples, you should do it so that you get a complete rehearsal of your study. And then you do a write-up of your synopsis to be submitted for approval. So there you write down the title, as I stated, very concise, in a PICO format, a background. Why this study? Why do you want to study this? What is the literature existing till date? Put some review over there. Certain articles can be written over there. You may have a master article from where you have taken that concept and which you are further working on. So review of literature should be written. Then aims and objectives, material and method. Then this is all to be written in future tense. You are going to do a study. You have not done the study. So it is in a future tense that is the way the study will be carried out. Statistical analysis which you are going to use in that particular study. Then institutions where the study will be carried out. You may need a VNIT in that case. You may need a biochemistry lab to do your PCR. So institutions required. The duration of the study, which shouldn't be more than 22, at the most of 24 months, but that also I feel, I tell my students the study should complete in 20 months. So that 4 months are in your hand for the results and the statistics and for writing the dissertation. So that should be in your hand, not to pay the late fee, but everything should be in time. That should be the submission before the submission date or by the submission date. Then the cost of the study, there you have to write down. If the cost is high, who is going to fund it? Self-funding student write down, but you can look for funding agencies. In one of our case, we got funding from the ICMR. The university is also funding. So search for the funding agencies. If the research is really good, you do get the funding from university, from ICMR, you do get it. And then references are to be written down. So that is the way a synopsis is prepared. And then it goes through approval. From where it goes through approval, the first step where the synopsis needs an approval is from the institutional research committee. The institution where you are studying, that research committee of the institution will first give an approval. Many of the limitations or the drawbacks in your study are pointed out at your institution level only. Give a thought, take it positively, and improve in your synopsis. Then you need an approval from the institutional ethics committee. They will look into the ethical aspect of that study. And after that, it is submitted to the university, and the university synopsis committee gives the approval. So the ethics approval is required. And yesterday, Dr. Toshniwal has very well covered what is ethics. Just to revise, It is the principles of right conduct. It is for the benefit of the patient. The study should be do no harm to the patient. The patient should not be forced to be a part of a study, but you should explain the study in such a way, telling him how beneficial it will be for you as well as the other patients. So he himself will volunteer for the study, and then you should take an informed consent, and then you should give justice for participating. The patient should be definitely benefited. So a consent form, which has two parts, a statement describing the study and the certificate where you take the consent. The consent form should be in a local language, in a simple language where you explain to the patient understands what you're going to do in the study. So once the study is planned and all that, then you start with the data collection. So accuracy in data collection, and there should be a proper unbiased interpretation of the data. You should be very honest with the data which you get it. I wanted this way, but I got it this way. No, honest. Whatever you get it, write it. For everything, a reasoning will be there. You'll try to reason up. It will open your think tank. Why I'm getting these results? Maybe the earlier literature, the earlier authors have written that this works this way, but I am getting the result this way. So I have to reason it. I have to see for a justification. Let whatever be the results be very honest in them and interpret it unbiased. So even in data collection, you should have parameters as many as necessary and as few as possible. When you take any of the parameter in your data collection to collect your data, you should question why this parameter, how this parameter is going to answer my research question, and how can I measure it or assess it? Is it reproducible? Does it have a validity? That you should question it and then use that parameter. And then once the data is ready, you are getting the results, you should try to tabulate it at the same time when you are getting the data. So when you put it in a table, it is an orderly arrangement of the data. So there, the table makes it very clear. A comparison can be done. In this group, I'm getting this. In this group, I'm getting that. So this will start your thinking process before you take your results to a statistician. I am getting the result this way. So it will start giving you reasoning for it. That saves space also. It summarizes the data and provides a basis for statistical computation. So the statistical analysis will be taken by Goel, sir. Then the graphs are done on it because a picture is worth more than 1,000 words. And then you come to writing a discussion. And yesterday, Sridevi madam has very beautifully elaborated what is a scientific writing. Discussion is nothing but a scientific writing. Where it is written to attract, but not at all to repel the readers. So you have to write over there why this study, what the study was, its objectives, how it was carried out, your material and method. And then the results are to be compared, discussed with studies which have the similar finding, with studies which have a dissimilar finding, and try to answer it, why my findings are dissimilar. Then you should write down the clinical implication, limitation of the study, scope for future research. And then the last in it comes the summary and conclusion, which is a miniature of the whole study. Again, the same things you have to write down: aims, objective, study sample, summary of the finding, and the suggestion for future research. So pages in the dissertation should not be less than 50. I think it is never less than 50, but should not be more than 150 also. So try to write a scientific writing so that it is less than 150. Then references in a Vancouver style as it comes in the text. We accept this style, not a Harvard style. Harvard style means alphabetical. This is Vancouver style as it comes in the text. And that also has to be written in a proper format. Name of the authors, 6 authors, comma between authors, then full stop. Title of your article, full stop. The name of the journal and the year, semicolon. Issue and volume, number, colon, and then the page number. That is the way for the journal. For the book also, you have to write the place of publisher, the publisher company, year of publication, page number, volume. When it is cited from the internet, their author, title, year, URL address, the month, date, and year when it was assessed. And then comes the D-Day, the dissertation submission. You have to sign, the guide will sign when totally agrees with it, when the guide, it has been made in the proper format. The HOD will sign and the dean will sign, and then it is submitted. The research doesn't end over here. Research is not complete until it has been published. You need to communicate your work to others that will open in areas for them in that field of research. So you need to communicate through publishing the manuscript. So 80% of the publications come from 20% of the individuals. That is the finding which is there. But no, 80% of the publication should come through 100% of the individuals.